Caribbean Development Bank, CDB, and the Organization of Eastern Caribbean States, the OECS, have embarked on a project that the partners hope will help member countries better assess poverty and drive national and regional development. The $2.8 million program was launched in St. Lucia on Tuesday, July 26, 2016.
CDB officials say while borrowing member countries have experienced significant socio-economic gains over the last 2 decades, poverty remains unacceptably high. Despite improvements on how poverty is measured, many Caribbean countries fail to produce up-to-date poverty figures and are unable to assess non-income dimensions of poverty. The Caribbean Development Bank and the OECS Commission hope to change this through the US $2.8 billion Enhanced Country Poverty Assessments Program launched in St. Lucia on July 26. The bank's Social Sector Division Chief says the program is a response to the need for high-quality data on poverty.
The assessment and analysis of poverty is therefore essential to our understanding of how that phenomenon is changing, particularly the non-economic aspects such as vulnerability, social exclusion, time poverty, seasonality, and problems in access to services. CPAs will continue to be the main basis on which such policy, poverty reduction strategies, and human intervention will be derived.
Director General of the OECS, Dr. Didicus Jules, says up-to-date, accurate statistics are crucial for rational and empirical decision-making.
Frankly, when I look at the landscape across the entire Caribbean, I find it really puzzling why we are not where we should be with statistics. Because if you want to, especially in the context of scarce resources, decision making can only be made more effective if we do so on the basis of analysis of the data that we have available to us. And speaking for the OECS, we have a population minus Martinique of 600,000. With Martinique, it takes us to about 1 million. And with Guadeloupe, who's potentially a member, that would take us to 1.5 million. That equates to one of the smallest databases in Microsoft. There's no reason why we couldn't have everything in one interactive database.
The most recent statistics put poverty across the region at 20%. The partners say indicators such as the impact of HIV/AIDS and natural hazards as well as aging populations need to be factored into the formula to reflect a truer picture of the situation. The Enhanced Country Poverty Assessment Program hopes to strengthen data capture analysis and interpretation to improve living conditions across the region. Joachim Duplessis, HTS News Force.
And over in Dominica, $33.2 million has been assigned to the Ministry of Health and nearly $5 million allocated for 6 schools.
The Ministry of Health and the Environment is getting 10.6 of the 2016 capital budget for this financial year. The allocation for the ministry includes the cost of filling vacant staff positions. The new National Hospital is accounted for in this allocation. The new hospital is being grant-funded by the People's Republic of China with counterpart financing from the government of Dominica. The long-awaited new hospital has been the subject of discussion between local and international partners for some time. But according to the Honorable Finance Minister, Prime Minister Dr. Roosevelt Skerrit, the project is finally here.
As usual, some said it could not be done, and it will not be done. Many who poured scorn and cold water on this initiative clearly did not understand the intricate planning process required in the building of a hospital, especially on the same site of an existing hospital in full-time operation. Right here in the region, we know, for example, that it took a particular country decades to conceptualize and finally agree on the structure and layout of the hospital facility. In another country, the planning process for and the actual refurbishment of the hospital stretched over 2 terms of an administration. In a third country, after more than 15 years under active consideration, discussions are still continuing over whether that particular hospital will be refurbished or replaced. Here in the Commonwealth of Dominica, some people expected that with a flick of a light switch, who would just set out one morning, break ground, and start to build the hospital.
He reiterates that this is not the end, but in fact the beginning of some inconvenience to healthcare providers and patients.
Clearly, we know that there will be some level of inconvenience to all special interest groups, namely to patients, healthcare professionals and other ancillary staff, visitors to the hospital, and persons providing products and services to the institution. This inconvenience will be minimized as much as possible, and I dare say will be worth the end product when we receive a modern hospital facility fit for the third decade of the 21st century.
The University of the West Indies, UWI, Seismic Research Center reported 2 earthquakes yesterday morning, one off of Martinique and the other off of Trinidad and Tobago. The first, a 4.3 magnitude quake, occurred at 3:58 a.m., 98 kilometers northeast of Martinique's capital, Fort-de-France, 112 kilometers east of Roseau Dominica, and 141 kilometers northeast of Castries, St. Lucia. Then at 9:13 a.m., a 4.0 magnitude tremor struck 71 kilometers northwest of Port of Spain, 95 kilometers west-northwest of Arima, and 102 kilometers northwest of San Fernando, Trinidad and Tobago. There were no reports of any damage or injury. Up next, your international news. We'll be right back.